Well, good afternoon, everyone. My name is Jamie from meetjamie.com, and I'm coming to you live today to talk about something very important that's been something that I've been thinking about when it comes to mistakes that I see people make when they first sign up for Medicare. So, my name is Jamie. I'm a licensed insurance agent. I help people understand how Medicare works as well as connect them with the coverage that fits their needs. And I've seen and talked to hundreds of different people all over the country who are thinking about starting Medicare and they're transitioning into retirement. And so, in today's video, I just want to talk about one common thing that I see. And so, hopefully, you can see me and hear me okay. If you have questions along the way in this live stream, feel free to ask them in the chat, and I may extend the live stream out a little bit longer if I do get some of those questions about Medicare. So, what's the number one mistake that I see people make when they're thinking about starting Medicare? Well, that would be assuming that their health today will be the same tomorrow. What do I mean by that? So, when I first do a consultation with someone transitioning to Medicare, I try to get an understanding of what their current health insurance situation is. Where do they get that health insurance? Do they enjoy that health insurance? How long have they had that health insurance? How well has it worked for them? And after talking to hundreds of people, you hear a lot of different scenarios. You hear from people who are working for large companies. You hear from people who are working for small companies. You hear from people who have health insurance through their spouse's employer. You hear situations from people who haven't had health insurance for many, many years. The number one mistake that I see people make in all of these situations is that they assume that their health today will be the same tomorrow. And that is a huge mistake because, as you can imagine, as we get older, our health tends to deteriorate. It doesn't tend to improve. And so, even though today you might be healthy, today you might not have any sort of health concerns. Maybe you never go to the doctor. That can literally change overnight. And I know that because I've seen it firsthand. I have clients who, the very first time they ever met with me, told me, I don't ever go to the doctor. I don't ever take any prescriptions. And I haven't been to the doctor in years. Well, then they called me shortly thereafter, and this has happened multiple times. It's happened so much that some of my clients and some of the people who've watched me here on YouTube say, "Were you talking about me in that video?" The answer is no, because I've seen it happen in multiple situations where somebody, the very first consultation they had with me, they went through that whole thing and said, I'm healthy. I don't think that I need that insurance because of where I've been. And I've literally seen it change overnight. And in this video, I thought I would share just a couple of stories. This goes back many years now, but I remember one of the very first Medicare clients that I ever got was another insurance agent, and they didn't understand Medicare. They didn't know how it worked. And so I did that initial consultation that I do with a lot of people, and through that process, this person decided that they wanted to go the original Medicare route with a Medicare supplement as opposed to a Medicare Advantage plan. And so that's what the route that we went. He was new to Medicare, so he qualified for a Medicare supplement because he had the Medigap open enrollment window. He wasn't subject to medical underwriting, and he got that coverage in place. And I'll never forget, I checked in with him a year or two later and I said, "Hey, how's the policy working for you? How's it been going?" He said, "Well, I think it's going pretty good. It seems to be paying for what I need it for." And I said, "Well, let me ask you this. How did last year go for you health-wise? Like, did you have to go to the doctor much? Did you have any issues health-wise?" And you know what he said to me? He said, "Last year I spent multiple weeks in the hospital. I don't remember the exact number, but I do remember that it was multiple weeks in the hospital. Now, here's what I knew immediately. I knew immediately that a person who's healthy, a person who feels like they don't really need that much health insurance would never be able to anticipate spending multiple weeks in the hospital. Therefore, they couldn't imagine spending money on a Medicare supplement plan because obviously Medicare supplement plans have, generally speaking, a higher monthly premium than Medicare Advantage. But if a person could have seen that, they could have seen, hey, down the road, you might spend multiple weeks in the hospital. Then guess what? They would say, sign me up for the most comprehensive plan because I want to make sure that I'm covered. And I understand human nature because I am just like anybody else. I don't want to spend for something that I feel is a waste of time. And here's what's funny about this situation. When he asked me, what do you think I should do next year for my Medicare? I said, don't change a thing. And the reason is now that he had developed a health issue, now that he had spent multiple weeks in the hospital, if he wanted to down the road say leave a supplement plan and come back to it, most likely he would not be able to pass the medical underwriting process. So you want to think, if you're new to Medicare, if you're getting ready to turn 65, if you're trying to figure out, hey, which route do I go, what coverage do I get, don't just think about today, think about tomorrow. Someone once said, insurance is meant to cover the unknown risks. We all probably have property insurance. We probably all have car insurance. And what is the one thing that we hope? We hope we don't have to use it. But if we do, if we have to use our property insurance and file a claim, or if we have to use our auto insurance and file a claim, guess what? We're gonna hope that we have good coverage, right? When you have to make that claim for damage to your home or damage to your car, at that moment, you're not thinking, well, I'm glad I, saved money on my premiums. No, you're thinking in your mind, you're thinking, I hope I have good coverage and it's going to cover the need that I have. So again, this is just something that I get to experience as an insurance agent who talks to people all the time about Medicare, who talks to people all the time about health insurance. And I feel like it's my responsibility in the course of these conversations to say, hey, let's not just think about today. Let's think about tomorrow. What would happen if this happened? And to me, then I have done a good job helping you understand Medicare and helping you be prepared for the unknown. That's what this channel is all about. I talk about Medicare, how to make the right decision. If you enjoy videos like this, please consider subscribing to the channel. If you have questions, you can always leave me a comment below, or you can reach out to me through my website. It's just meetjamie.com. Thanks for watching. We'll see you in the next one. Have a great day.